and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. My name is Adrienne Cleverly, and today we are joined by Ioan Humphries and Dr. Marie Gabe. Ioan Humphries is a Senior Research Officer and Health Economist in the School of Health and Social. Ioan has worked in health service research for 20 years and has collaborated and conducted research with Lymphoedema Wales Clinical Network. Dr. Marie Gabe is a dedicated healthcare professional who began her career in adult nursing. In 2020, Marie joined the Lymphoedema Wales Clinical Network as the National Research and Innovation Lymphoedema Specialist. Since taking on this role, she has led pioneering work aimed at enhancing the use of patient-reported outcome measures, which are known as PROMs, and patient-reported experience measures, helping to ensure that patient voices are central to service development and clinical decision-making. Ioan and Marie first collaborated on research focused on improving medication monitoring practices in care home in 2012, and more recently they have worked together on a range of research projects, building on their shared commitment to impactful and value-based lymphedema research. So first of all, welcome both, and thank you for coming in to talk to us. I'm going to come straight to you, Marie, if that's okay, and ask you, if you had to describe lymphedema to someone in 60 seconds, how would you describe it?
Okay, so I've got a really short answer. The first one is it's long-term swelling that lasts over 3 months. So sometimes you'll hear it's being called chronic edema as well. But a bit more around the background to that. So we've all got a lymphatic system, which is a network of vessels that move a tissue fluid called lymph around the body. If there's too much fluid or if the system doesn't move it properly, that fluid accumulates, that causes the swelling. That fluid's full of protein. So that means it can cause sort of skin changes. People with lymphedema can be at risk of infection, which can worsen their lymphedema, their swelling. And of course, then it has much more wider impact on their person. So we know it causes emotional challenges, issues with social contact and being out and about. So it's a whole life sort of impact, long-term condition.
I can see you nodding away there. Was that a perfect example of what lymphedema is?
Yeah.
Yeah.
Yeah, absolutely, it was.
Yeah. Good answer then.
I could tell you a lot more, but
maybe you will as we go through. But are you able to tell us a bit about the Lymphoedema Wales Clinical Network and what it is that you actually do there?
Okay, so we're really fortunate. Our clinical director, Dr. Thomas, really set about, way before I joined the network, setting about putting together a lymphedema service for Wales, because if you go back to 2010 and before that, there wasn't an equitable lymphedema service in Wales at all. So in 2008, they developed a strategy to sort of highlight what lymphedema is and the importance of providing care. And through that managed to secure £1 million for recurring funding for lymphedema. So the Lymphoedema Wales Clinical Network consists of all 7 health boards in Wales. So we've got local lymphedema services and teams in each of those health boards. And then we've also got a national team, which are hosted within one of the health boards, which happens to be Swansea Bay University Health Board. And that's where I work. Together as a team, we are really fortunate that we've got a whole Wales approach. Means we can standardise. We can also ensure that the services we provide is equitable. And I know Ioan will talk about it later. We really drive forward on value-based services, so services that really are efficient, effective, and improve outcomes for patients.
So patients are ultimately at the centre of that then, I would...
Yeah. And so lymphedema can affect people from across the ages, from birth to older adulthood. Typically it's more common in later life. But yeah, it usually affects the lower limbs, the legs, but it can affect any part of the body. So yeah, they're really at the centre of what we do.
So on that note then, you touched on working with Swansea Bay University Health Board. Ioan, are you able to tell us a bit more about the collaboration, with the network?
Yeah, so Mel, Dr. Thomas and Karen first approached us back in something like 2014, 2015. And they wanted to evaluate the Always service to give it a value so they could get the work independently evaluated by myself and others and in the team at the time. And we were then able to get it published, and those findings from the report that we produced, she could Dr. Thomas could take that to the policymakers and people with who hold the purse strings to say, can we have more money to roll this across, and expand across all the health boards, as Marie touched on just now.
So on that then, can you tell us a bit more about what your research is focused on at the moment?
Oh, we're quite lucky at the moment. So we've just had a paper published. So I'll talk about what we've done with that.
Yeah.
So when the service was sort of first starting up, NHS Wales is the only health board, the only service. I'll completely back up on that one. So where did I start off?
Your current research
Current
and what you've just had
Right, I'll
published.
start with that. Yeah. So we'll talk about some of the current research we're doing at the moment. We've just had a paper published. So I've got to go back a little bit to describe why this paper came about. So NHS Wales is the only service to provide a type of microsurgery on the NHS. It's called lymphaticovenous anastomosis. So it's bringing together the lymphatic system and the venous system. And when that was sort of launched over a decade ago, they identified they needed to measure the benefit. And we've got different ways of measuring the impact of things. And one of the things we didn't really have was a patient-reported measure that would say, well, actually, what did that mean for the patient? So back in 2015, they developed some key sort of questions that we could ask patients to understand the benefit of this type of surgery for them. So when we were routinely collecting that, and then in 2020, when I joined the network, we set about developing those questions into a standardised patient-reported outcome measure, a PROM. We call it LymPROM because it's a lymphedema patient-reported outcome measure. And so in 2020, we started a very long journey, didn't we, Ioan, on validating it. It's no small task to start developing a PROM. And that's the paper. That's probably the most significant paper we've had for that.
Yeah, I mean, to have a validation paper, and it was published in PLOS One a couple of weeks ago,
Yeah.
it's quite a big thing, and now we got that validation behind us. It was myself and senior trial statistician in the Swansea Trials Unit and ourselves. So, yeah, it's a really big paper, and I think people are starting to, other organisations around the world are asking to use LymPROM. So it's become and it's showing really, impact as well. So I'm an author of an impact case study, so we're sort of looking to incorporate the results and the impact from the LymPROM rollout and the validation into a further impact case study.
So that research then is already paving the way for the next steps, essentially.
Yeah, absolutely. Yeah.
Are you able to tell us a bit about the impact case study, or?
So I authored it back in 2021. So it was all the work that I've done with Lymphoedema Wales.
Yeah.
And it was based a lot around the OGET program, which is the on-the-ground education program. And out of that came a pathway called the wet leg pathway. So when you have edema, people, when their legs swell up, literally they have wet legs. So that came out of the research, and so that was form a big part of the impact case study. So that was put in the last round in 2021. Not sure what the star rating was, but so we're looking now to either do a continuing one for 2029 ref, or do a completely new one based possibly on the LymPROM stuff. So it's all up in the air at the moment. We're all still in discussions to what, but our research has got so many different strands. I guess from the LymPROM stuff, the psychology work has come out of that, because in the LymPROM, people, you could see that they were marking quite low on their sort of desirability and their clothes shopping, and the female people who answered. So it was sorry, that was a bit clunky. So the female participants who answered the questionnaire. So Lymphoedema Wales then started developing some psychology groups for people to take part in and to see how lymphedema was affecting not just physically but also psychologically.
Because it can have a knock-on effect as well, can't it? When you've got something chronic like lymphedema and then you've got like these psychological barriers, you can go down the route, can't you, of developing other symptoms and then...
Absolutely.
Is that a challenge or...?
Yeah, because lymphedema is lifelong. We can't prevent it. We know some of the risks, so we can do the best to give the best advice and education to reduce your risks and manage it in the early days, but it really relies on patient engagement. There used to be something we called the 4 cornerstones of care, which were about skincare. So that's washing and drying your skin, because your skin is first and foremost the barrier of your body. Movement, so the lymphatic system, and this will lead into what your first question was. Your lymphatic system isn't necessarily pumped around like your heart pumps your blood around. So some of it relies on movement, your muscles. We talk about lymphatic drainage, so just light touch movement of lymph fluid under the skin to where it would naturally drain. And then the key component of what we do probably provide to care for patients is compression. So those tight garments, you might have compression socks, sleeves. It can affect your midline, your torso, your genitals. So there's all different ways of compressing. But all of that relies on patients being able, physically and mentally and socially, to go home and do that. We do collect a lot of data in Lymphoedema Wales, and we have information around, we've started collecting information on the Welsh Index on multiple deprivation, so you get an idea of where our patients are coming from. And we've found that those that are in more deprived areas tend to have more severe lymphedema. We need real support for patients to come on board with our care. Since we've had the psychology programme, which came about, as Ioan said, partly because of the Lymprom showing that there were real emotional and social challenges with having lymphedema. So to support people to live well, we've got the psychology programme, and I lost my train of thought there.
You did touch a little bit on the data programme. Are you able to tell us a bit more about that in terms of whether it was a challenge, or is that something that's been introduced?
Yes, so we've got a data analyst in the team. We're really fortunate to have a data analyst because Lymphoedema Wales has always been set, because it covers all of Wales, we've got great capacity for information and data. Most of the services collect information on paper, so we've got paper case notes, as you might imagine.
Yeah.
Some services are moving to digital. So a key challenge for the data programme is, of course, you've got loads of information, but it's not necessarily at our fingertips. It's not digitised. So since last year, we've started collecting patient-level clinical information. So that's given us so much more information. And that digitising also helped with our Lymprom, because when I joined in 2020, we were still very much in the days of paper-based prom collection and offer it to a patient to complete while they were in the waiting room for their appointment. But of course, the pandemic hit, and it was less use of waiting rooms. And even now, there's been a shift towards virtual appointments. So a challenge and an opportunity was moving our prom digital in 2020. That's really helped us along the way.
And the thing with data is that once it's sort of given to me and other statisticians, we're able to do statistical analysis on it and show in our reports and in our papers that certain things in the data are statistically significant, and that really does then open eyes in again the people who hold the purse strings and saying, right, there is something significant going on here.
So this new data programme has been really useful for you then?
Yeah, absolutely. The more data we collect, the better, because it gives that certainty then in the sample size.
So it's growing effectively.
Yeah. I mean, obviously, again, we've there's a condition called cellulitis that some people with lymphedema can get, and you don't have to have lymphedema to have cellulitis, but a lot of people do, and we've been lucky to be able to do some work with the Sale Data Bank.
Okay.
So again, that big data, you're talking about millions of records there, and we're able to using data tables to track people across decades with these lymphedema and cellulitis codes. So we've published at least one paper on cellulitis, and we're in constant contact with the SAIL team, which is really, really
A
important.
few people have talked about that SAIL data bank. It's really positive in terms of research, isn't it? And actually trying to get more patient-centred in one way.
Well, yeah, and it comes down to prevalence and incidence of whatever condition you're talking about
Yeah,
then as
'cause
well.
one of the newer pieces of research that we're doing is around ethnicity. So, depending on certain ethnic minority groups, the evidence or papers suggest that they're more likely or more at risk of developing lymphedema in certain situations, but they're not necessarily coming through to our service. We don't know why, and we don't know what we can do to help that. So we're working, our data analyst has got a project that's using SAIL data at the moment to help us understand, a little bit more around the need and how we can best support the lymphedema service for everyone, including the rarely cured in Wales.
And would that tie in with the work you've done with the lymph problem then? Because you've touched on that, but can you tell us, well, you haven't touched, you've talked about it, but can you tell us exactly what it is about how it became validated? Or is that, you both looked at each other then, who's going to take this one?
Well, in the statistician would be good here. No, in the validation process, there's certain steps you have to go through, and those steps, the name of them are not Prisma. I can't.
COSMIN is the short,
COSMIN.
so it's something like consensus.
Consensus of the best and the way to validate a prom is the COSMIN, and so we followed those steps, and in those steps data is important. So again, for that sort of statistical analysis and the statistical power that's in there, so for that sort of, and there's different things called construct validity and internal validity and things like that. So so you have to tick all those boxes basically. And another interesting thing we did as well, so when we were talking about the microsurgery, the LVA surgery, I won't try and do the long one. The short version is LVA. We used something called EQ5D 5L, which is used around the world, and it's quite a generic prom. It has been validated for some, lots of conditions and diseases, etc. But at the end of the day, it's quite a generic tool. So that was one of the reasons why we wanted to have our own prom, the LIM prom. But part of that validation process, we sort of mapped the Q5T results that people gave with the LIM prom results, and they found it was quite a nice match as well. So it validated that we were doing the right thing, and
it's not just being used here.
No, and it's been translated, isn't it, into other languages?
Yeah, that was the part of the journey with the validation. So you can't just, so Wales is a bilingual country, we couldn't just ask somebody to write it in Welsh and off you go. And that was an interesting journey. So there's only a small piece of that in the validation paper. So what we did, probably boring you a little bit, but we did 2 forward translations. So we took the English paper and had 2 separate Welsh speakers translate it into Welsh, and then compared, and then did the third person do a forward translation back into English, and then compared again. And that highlighted, I'm not a Welsh speaker, but it highlighted interesting things that I'd never thought of. So even down to, you talked about psychology and the impact of lymphedema on the whole person. So one of the questions on LymProm is about impact on intimacy and desirability. And intimacy was translated in terms of proximity and closeness, which was quite interesting. And when we looked at the terms we used to describe pain, we got pain, ache and discomfort. But in Wales, we have different colloquial terms, and some of them are used interchangeably. So it was interesting. So it's been a very long journey. 2020, when we really started pushing this collection forward, and the digital collection was absolutely key to achieve and all of that. And that links with why our collaboration with the university works so well, because we complement each other. I think our skills, our expertise. We've got a clinical team. We've got researchers, but we don't have statisticians. We don't have health economists by background. We don't. It really means we collect a lot more information about value.
And you've touched on like the ethnic groups and some surprising outcomes in terms of the psychological and the Welsh translations. Have there been anything significant that have been thought-provoking or unsurprising that you hadn't necessarily anticipated?
I would say so. Got so much data. more than we can do with it. And that just poses more questions sometimes than answers. But with the Lymprom, we could see that there were pockets of groups that were affected in different ways. Of course, it makes sense, and you'd think it makes sense when you say it out loud. But until you have the data to show it and show that it's an issue, then there's nothing you can do about it until that point. So we've got another question on body image on the Lymprom, and unsurprisingly, it's the younger cohorts who score most highly, so they have the biggest impact on their body image. And of course, that makes sense. And then questions around things like personal care. Sometimes there's more challenges for older people, and of course that makes sense. But we've got the data to show it, and we've got information around the differences sometimes of men and women with lymphedema. What tends to be the key challenges or issues or impact for them? That's been really interesting. And then at the bottom of Lymprom, we have a free text, so people can write whatever they like at the bottom of Lymprom. When we collected on paper, I think because you're in a waiting room area, there was less mental space to think and write down what you were feeling. But since we've been digital, we get a lot of stories that really give the lived experiences for those with lymphedema. And we've just submitted another paper which is looking at those free text responses and the challenges actually. So for me, it was all sort of learning along the way, and it really was interesting to see that we could now know more about actually lymphedema and how it affects different people.
I think what hooked me at the beginning, right back in 2014-15, is that Mel told a story about a gentleman who hadn't been able to put his shoes on for about 6 weeks or possibly even 6 months, I can't remember. And through the drainage and the compression, he was able to put his shoes on finally and go out, and was able to go to see Swansea City play for the first time in ages, and that obviously, the health related quality of life benefits to him, are immeasurable, and so I think that's one of the stories that really hooked me, is that this is a really valuable and worthwhile, piece of research that we need to be doing.
And that's something that the free text you described, how do you tell that story through a box, or not having the opportunity to express, that free text does give you those stories, doesn't it? And it does help you sort of find those psychological things.
Absolutely.
Because we did more recently a small research project looking at the impact of a type of pneumatic, so machine compression at home.
Yeah.
And we did interviews in that. And again, it highlights the real lived experiences. So some participants would talk about not being able to lift up their grandchildren, or talk about their relationship with their partner as they're putting on their compression and taking off the compression, and how that made them feel.
Yeah. There's really powerful stuff coming out of that.
And it's the patients, like you said, we started with the patients at the very beginning, and it is literally a patient journey, isn't it? Because they're the ones that are living it, and we don't understand it if we're not going through it.
Yeah. And from Lymprom has come Cellprom now, isn't it? So
I was just going to say, is there anything next? So
there's lots next, but yeah.
Do you want to give us one or two?
So Cellprom, I guess, is the natural sort of, progression from Lymprom, and we're going to validate it again in a very similar way, and hopefully get that published and, out around the world. And I suppose the next other thing is the heart failure stuff, is it?
Yeah, so the Cellprom is the one we use for cellulitis.
Yeah.
So it's for them to report on their outcomes. And again, the whole life impact, biggest challenge for those with cellulitis, as on the Cellprom, is fear of a recurrence. So cellulitis is an infection, and it can be a risk for lymphedema. It can also be a complication and worsen your lymphedema. People can be really, really poorly with it. So that fear of having another episode, and they say between 10 to 50% may have another episode without real good information around reducing their risk, which is what our National Cellulitis Improvement Programme do. So they're reducing the burden of cellulitis. That's a big bit of work coming up, validating that Cellprom. And the heart failure stuff. So again, at the patient journey, we do a lot of collaboration, not only within the university, but also within other specialities. We try not to work in a silo. We definitely do our best to work together. Heart failure, one of the sort of cardinal symptoms of it can be swelling of your lower limbs. So we started doing some work in heart failure clinics, going into their services and looking to see if we can identify undiagnosed lymphedema. And we did that in, I think it's 4 health boards so far, and I think over half of the patients they saw did have lower limb swelling and potentially lymphedema, and I think less than 10% maybe were known to the service of lymphedema, so identified undiagnosed lymphedema. And then in doing that work, heart failure, the team also identified actually how many people are coming into lymphedema with potentially undiagnosed heart failure. So that's the most recent piece of work, and it's really interesting. Again, I think it's over half of those that came into the lymphedema service. They were offered a type of blood test that can be used to identify potentially heart failure, and over half of those had a raised score, which meant they needed intervention, and that's not something that's normally done. Typically, as part of the study, we broke down the number of steps it would normally take to get a diagnosis of heart failure, and I think they had something like there would normally be 12 steps. So the patient would go to their GP and maybe not be clocked at that point, and it'd be 12 points before they actually get a diagnosis. But if we've got patients coming into our service with lower limb swelling, which can be a sign of heart failure, not always, but can be, and if they have some other risk factors or other symptoms that we would attribute potentially to heart failure, in offering them a point of care test in that blood test at that point in their appointment, we can reduce those 12 steps to 6. So
yeah, that's huge.
yeah.
Well, you're going to have to come back and tell us more about that when you've got some more.
We will.
It's such an interesting topic, though, isn't it? Because it's, well, everything. It's all fascinating, but unfortunately, we're running out of time. So you are going to have to come back and tell us some more, because definitely. I feel like there's a lot more to be said. Thank you both for coming and sharing your experience of the collaborative research that you've been doing. If you've enjoyed today's podcast and you'd like to find out more, you can reach out at Lymphoedema Wales Clinical Network.
Yeah, we've got our website.
Brilliant. So you can reach out there, and you can also reach out with Ioan Humphries, who you can find on the staff pages.
Yep.
Or you can reach out at us at the Healthy Aging and Chronic Conditions Research Institute. Thank you both once again for coming in. I have really enjoyed listening to your research.
Thank you. Enjoyed it.
Thank you very much.